So when I was 5 years old, my mother stopped ordering for me at restaurants. When the waitstaff came, I always cried and looked down and got shy and basically begged her to order for me. You know what you want, Christina, she said to me, so ask for it. There have been many times in my life that I knew exactly what I wanted and I was too afraid to ask for it. I was afraid of being too big, too much, or too demanding. And I know I'm not alone in this fear, or my attempts to be more palatable to others. Opening a business where I connect with and serve women is the best thing I've ever done for a lot of reasons. One of which is that it really illuminated the ways in which I made myself small. The ways that I tried to shrink myself and to not be as big as I am. And I've watched others do this too. I'm a pelvic floor physical therapist, which means I help both cis and trans women get back to the things that are important to them without pain or restriction. So sometimes that is working out without leaking, sometimes that's having pleasurable sex, sometimes that's having active pregnancies and postpartum periods, and sometimes that's being able to play with their kids without pain. One time, I was working with a trans woman after bottom surgery who could have an orgasm by herself, but she was unable to do it with a partner. Every time she tried, she had a lot of pain. And I was trying to help her relax and to relax the muscles of her pelvis, but nothing was working. She started apologizing profusely. And so I asked her, why? And she looked me square in the face and said, my biggest fear is being a difficult patient to medical providers. This woman had had shitty experiences in healthcare. And she had been dismissed and ignored and belittled, and she was worried about making my job hard. It sounds so obvious when you hear it out loud like that, but I know exactly how easy it is to let someone who is telling you that they know what is best for you, be that a medical provider, a boss, a husband, a sexual partner, or be any of those people. 5 years ago, I had a pelvic surgery by a surgeon I had met one time who told me she had all the answers, she had all the solutions for my problem, and she told me surgery was my only option. I was literally in school learning to be a pelvic floor physical therapist, learning to be a pelvic floor expert and a medical provider, and I was led to let go of what I knew about my body and about medicine and to defer rather than advocate. I was also afraid of being hard for medical providers to work with. Ultimately, the surgery did not help my symptoms, and the whole situation left me feeling helpless and unseen. Another woman I worked with was having pain and light bleeding during penetrative intercourse, but when I checked out her pelvis, I couldn't find anything that explicitly made me think that this was her problem. So I asked her if she was engaging in foreplay before she encountered penetration, and if she felt aroused before she was having sex with people. Not really, she said. When I asked her why, she said, oh, well, you know men, they just want to get off. I'm not in the bedroom with people, and I have no idea how things play out in real time. I have no idea if this woman's partner really believed that, or if she just thought he believed that. But what I do know is this woman was having sex that was not only not pleasurable, but causing her physical pain and damage to some extent. It's another example that could seem a little bit extreme, but it made me think about how many times I had consented to engage in sex that I wasn't excited about or left me unsatisfied, without mentioning it to my partner or trying to change it. How many times did I listen to my girlfriends talk about faking an orgasm or giving someone a blowjob just so it would be over? How many times had I asked a woman if she's able to orgasm, and she said that she could do it by herself, but her partner never got her off? So I'm under no illusion about how challenging it is to break the habit of keeping your wants and desires to yourself in the name of making yourself small. And knowing that you're doing it is not a one-way ticket to cutting that shit out. When I offered to pose for this show, I was unsure if Tiffany would take me up on it, and then she called my bluff. And so when she did, I sat and brainstormed about how I wanted to pose. All of them were of me in the smallest shape I could possibly make myself. Arms folded, legs crossed, hiding my breasts, hiding my genitals, hiding my stomach. And then when the time came to sit on the cold ass floor in her studio, I thought of all the women I've seen in my practice and known in my life. Those same women who I've tried to give permission to take up space, to enjoy sex, to advocate for themselves and their healthcare, to be just enough as they are and to ask for what they want. So instead of closing, I opened my legs and unfolded, sharing a piece of myself in a way I hadn't before. So why do we do that, making ourselves small shit? Why can't we just ask for what we want and need? I obviously don't have it all figured out, but I think of asking for what I want like working out a muscle. It only gets stronger when you use it. So I send food back that isn't what I asked for, even if it tastes fine. I fire my doctor if we don't click, even though she seems smart. I ask for more money at work, even though I love what I do. And I ask for oral sex, even though I can come without it. I don't think asking for cunnilingus is going to change the fact that sometimes I hold myself back. But I also didn't think that finding a new doctor was going to shape the way I practice medicine. And I didn't think that asking for a raise was going to push me into business ownership. And never did I think that ordering my own food was going to teach me to ask for what I want.